Hello, welcome back to Actual Edge. Welcome back to our channel. Welcome back to your positive space in which everyone feels comfortable to speak about diseases that may carry some stigma in our society. Welcome all of you. We hope that you are doing fine. We hope that you're staying safe out there. We're very happy one more time to be here. Usually, our live date would be Saturday and Sunday. However, today we have decided to come here a little bit before so we can talk to our audience and ensure that all your questions remain answered. And we just want this space to be the safest for all of us. Now, before I continue, please confirm that you can hear me correctly in the chat box so we can start our new HIV journey with all Actual Edge followers. Always a pleasure from being here. Hello, David. Hello to the UK as well. Please confirm, David, and moderator El Duende Satirico, please confirm if you can hear me properly. As I can hear you without any issues. That's what I wanted to hear, David. Thank you very much. I'm hoping everything is doing fine in the UK. We hear a lot of positive news from the NHS recently confirming that HIV is being fought against by loads of pharmaceutical companies, which is always a positive thing. In the last two live streams we've had in the channel, we've been changing our approach. Hello, Achabi. Hello, El Duende Satirico. Welcome here. Always a pleasure to have you over. Thank you, El Duende Satirico, for helping me moderate this section and for being an excellent support to this channel. And Achabi Harrison, we're hoping everything is going great for you. We're hoping this Thursday is full of blessings. Great, Achabi. For us, the well-being of our followers means everything. We're going to start our session today by discussing an issue that we've been covering recently quite a bit. What does a HIV cure really mean? What does it really mean? So we have many different public organizations speaking about the cure. There will be a cure by 2030. We will end HIV by 2030. That's what we hear. We see it in the news every day. You even see it in Actual Edge quite often. But what does a cure mean? Does a cure mean you take a pill and HIV disappears forever? Does a cure mean you get an injection that will kill HIV? Well, we're sorry to disappoint you if this is what you feel. But a cure of HIV means eradicating HIV to the point where it is no longer an endemic disease. What does this mean? The strategy proposed by WHO 95-95-95. We've gone over this concept many times. 95% of people who have HIV should be tested. Of those people that tested positive, 95% of them must be on ART. And what is ART? ART is currently the only treatment in the market to deal with HIV. Antiretroviral therapy, keeping the viral load in your body so low that you can live a normal life, just like me, just like anyone who doesn't have the disease. Life expectancy, that's been a topic. A lot of our followers. Hello, Dr. Nagaraj. It's a pleasure to have you. Hello to all our subscribers from India. We know that our channel is extremely popular with Indian followers, and we want to say hello to Bangalore. We want to say hello to Adijabad. We want to say hello to New Delhi. We want to say hello to the Punjab regions. We want to say hello to everybody in India. Remember, India and Actual Edge are one. We're always delighted with all the people that follow us from India. We always love our Indian subscribers and how kind they are, how lovely people they are, how thankful they are. It's thanks to you that Actual Edge can live stream, can bring you new news about HIV, and it's our pleasure to assist you. Dr. Nagaraj, thank you very much for joining us in today's session. Well, going back to the cure, the HIV cure. 95, 95, 95. 95% on ART, and 95% of the people on ART must be in remission. What does being in remission mean? It means that the viral load that this virus contains was maintained low in your body. The problem is, we cannot think that because our viral load is low, we can stop taking ART medicine. The consequences of this would be quite risky. Why is this? This virus hides in the reservoirs of cells. What does this mean, the reservoirs of cells? There's certain parts of the cell where the virus hides, and we cannot identify it, we cannot find it. The problem is, ART will bring the viral load down. But what will happen in the moment you stop taking your ART? Well, unfortunately, the viral load will go up again. What does that mean? You may be asking that if you stop taking ART, it's very likely that you will be getting all the symptoms of HIV and in risk of getting AIDS. AIDS is the most advanced form of HIV. What does this mean? Once you get AIDS, it's over. A lot of countries in Africa where governments do not support their population struggle with AIDS because these people cannot afford ART, and their government is putting no support, no help. They don't even have public hospitals. Many countries in Africa, Burkina Faso, South Sudan, Ethiopia, we know because these people get in touch with us all the time. They're asking us, Actual Edge, please help us out. We can't even access ART. We are dying. Sir, send the cure to Nigeria. We would love to send a cure. The thing is, we don't have a cure. Nobody has a cure. The cure is ending the endemic. How do we end the endemic? By taking ART. How do we end the endemic? By fighting against stigma. How do we end the endemic? By having a healthy lifestyle. How do we end the endemic? By using PrEP before having sexual relationships. How do we end the endemic? By using condoms. By creating awareness. By spreading positive energy. At Actual Edge, that's our goal. We're not chasing a profit. We don't make money from this. What money can we make from this? We just want to create a safe space and a place where people can ask questions without anybody judging them. We are aware that India, despite being a beautiful country, is a very conservative country where people continue to have stigma towards those infected with HIV, where people continue to have stigma about homosexuality, where people continue to be scared of contracting HIV for giving someone a hug. Let's clarify something. It's a myth. You can only get HIV if you get in contact with someone who has it and there's blood on your behalf and on the behalf of another person. What happens if you kiss someone that has HIV? Nothing. The chances of you getting HIV from kissing someone that has HIV are 0%. And you may be wondering, what about other forms of contact, such as mouth to genitals, 0.005%, even less. So, fighting stigma, creating a positive place, these are the tools to making everyone feel comfortable for battling this disease and for battling traditional mindsets that still believe that this is a consequence of homosexuality, of being dirty. No, let's fight against that. Now, remember, guys, as I am speaking, I'll be checking the chat box. Sometimes I'd probably have it closed, so it will take me a little bit longer to respond. However, whatever questions you've got, I'll be very happy to support whatever you need. David, I really enjoyed the video about the sanctuary founded by Ravi Kant Babatle. Ravi Kant Babatle is a hero. Unfortunately, why do you guys think that traditional media outlets are not giving the necessary coverage to this man who has created a sanctuary, taking care of people that have HIV, taking care of the children that have been abandoned and have HIV? This person, Ravi Kant Babatle, is doing God's work on earth. This person is willing to sacrifice his freedom, his life, his well-being to promote a safe space, and his wife as well. Beautiful people. If you haven't watched the video that David is speaking about, I truly recommend it. It's called HIV Hero from Actual Edge, and it's a beautiful story. A beautiful story about a beautiful man. Someone who cares about the rest. Someone who cares about their brothers and sisters. Why are traditional media not speaking about this? Why do you guys think? Why do you guys think nobody says anything about him? Who is he pissing off? Who is he upsetting that media outlets don't want to speak about him? That's a question we need to ask ourselves. We need to consider if someone is doing God's work and only independent media like Actual Edge is speaking about it, there's a very big problem. And there is. Thank you very much, moderator El Duende Satirico. You're way ahead of me. I wanted to share it already, but you've beat me to it like you always do. Thank you, sir. That's the video. Share it over there. Feel free to watch it later, or if you don't want to watch it, it's perfectly fine. But we just want you to watch it. It's actually a really heartfelt video. And here at Actual Edge, we feel extremely proud, and we send all our love to Mr. Ravi Kant Babatle. If you're watching this, you are a hero. You are a saint. You keep the world going. It's thanks to people like you that you can do it. Chabi, you're welcome. You're welcome too, Chabi. You're welcome too. Welcome here. If you have any questions, Chabi, please feel free to ask. Here, we want to create a safe space. As we always say, we want a collaborative environment. So let me talk a little bit about understanding a little bit of HIV and aging and health. It's important for us to we often hear about the incredible advancements in HIV treatment. You probably hear it from us all the time, which have significantly improved the life of those living with this terrible virus. However, what many might not realize is that while people with HIV are living longer, they may face unique challenges related to aging and health. Why is this? Let me explain. Recent research has highlighted that individuals with HIV may experience age-related health issues such as frailty at an earlier age compared to the general population. This means that even though someone may be managing their HIV well, they might still be at risk for conditions typically associated with older age. The most common one is the aforementioned frailty. Frailty in particular is a state of vulnerability to health issues. which can arise from various factors like physical, cognitive, and emotional challenges. Studies have shown that people with HIV are more likely to experience frailty, which can lead to a higher risk of adverse events like falls, impaired conditions, loss of independence, loss of hearing, loss of vision, increase in your myopia. Basically, conditions that relate with aging. Conditions that will affect all of us the day of tomorrow. It's essential for healthcare providers to take, instead of an individual approach, something more general, something more of a holistic approach to HIV care, addressing not just the virus itself, but also the unique health needs of older individuals. We have a question. Let me see. Sir, any news from University of Western Bristol about HLP? I'm sorry, Dr. Nagarash, but as far as we're concerned, we're not based in the UK. That is convenient for us to know. And assuming that you're speaking about Bristol, the South City in the UK, which you probably are, because they have a top university there that focuses on venereal diseases, but we don't have any updates about HLP coming from the University of Bristol. Now, if you have any information that you would like to share with us in the chat box, we'd be more than happy to get in contact with this university and maybe bring them to a live stream in our channel. We'd be delighted to do such a thing. And Chabi Harrison, exactly, HIV and aging. How do people manage their health above 60 years? Chabi, they can manage it just like anyone who doesn't have HIV. How? How is this possible? 3 keys. Key number 1, take ART. Don't stop taking your medication. We understand the side effects can be very displeasing, can generate loads of discomfort, can destroy your digestive system. Nobody wants to suffer that. But unfortunately, this is the way it is. And Chabi, as I was saying earlier, it is essential for healthcare providers to take a holistic approach to HIV care, addressing not just the virus itself, but also the unique health needs of older individuals. Over 60, you should incorporate screenings for frailty and other age-related conditions. Healthcare professions can ensure comprehensive care for their patients. Now, remember that ultimately understanding the impact of HIV on aging and health allows us to better support and empower individuals with the virus and as they navigate the aging process. Now, together, we can work towards ensuring that everyone, regardless of their HIV status, enjoys a healthy and fulfilling life. How is this being done? Through ART, through a healthy lifestyle, through using PrEP. So, Chabi, we hope that answers your question. For those of you in the live stream, remember that we are here to support you. Whatever question you have, we are more than happy to give you an answer. All right. So please make sure that if you have any questions or if you have any doubts about your condition, about the medication you should be taking, to please ask it in the chat box and we will try our very best to give you an answer. Darlene, hello, South Africa. Oh, what a beautiful country, South Africa. Loads of our followers. I'd say it's our second most popular audience from Actual Edge is South Africa. Welcome. What part of South Africa are you contacting us from? Are you in Cape Town? Are you in Durban? Are you in Pretoria? Where are you from? Let us know. What background are you from? Are you Zulu? Are you Xhosa? Are you Afrikaans? Are you English? Welcome here. Are you colored? Are you Indian? Let us know in the chat box. And hello to all the South Africans watching this. Please know that from Actual Edge, we truly love that country. We find it one of the most beautiful places in the world, and we're always delighted to listen to what you have to say. Reading your emails. Don't think that we don't read your emails. We read every single of your emails and we get in contact with you as soon as we can. We're sorry if we haven't been responding. But right now, we have been in touch. I don't want to reveal too much because I want it to be a surprise. In Free State, Bloemfontein and Tswana. All right, beautiful. Darlene, welcome here. All our love to the beautiful country of South Africa and the beautiful people of South Africa. Darlene, if you have any questions regarding HIV, please ask in the chat box and we'll be more than willing to respond and supporting you with whatever you need. I was just worried about living with HIV at old age. Chabi, that worry, you need to stop worrying about that. You need to stop worrying because there's already a lot of studies, the most recent ones published in 2022, that confirmed that people with ART live on average a year or two less than someone who does not have the virus. What does this mean? It means that you can have a really long, healthy life without having to worry. You can have children. You can see your children going up. You can see your grandchildren going up. There's nothing to worry about. There's nothing to worry about. Now, Chabi, also consider frailty is what you should be worried about rather than the other one. Why should we be worried about frailty? Well, it's a state of vulnerability to health issues which can arise from various factors like physical, cognitive, and emotional challenges, like we already said before you asked this question. Studies have shown that people with HIV are more likely to experience frailty, which can lead to a higher risk of adverse events like falling, impaired condition, cognition, loss of independence. But here's the good news. Frailty is reversible by focusing on factors like physical activity. Exercise regularly, Chabi. We know it's hard. We know that you're probably from a very hot place. And exercising outdoors could be really tiring. But physical activity is what keeps us alive. Physical activity is what makes us stay strong. Also, nutrition and regular medical checkups, individuals with HIV can take a proactive steps to prevent and manage frailty as they age. So as Chabi, nothing to worry about. Now, Dr. Nagaraj has two questions. Sir, any progress from Adammune about AGT103T? Well, the announcement regarding Adammune's phase LB trials for its HIV candidate AGT103T is certainly significant in the pursuit of finding a functional cure. Not a sterilizing cure, but a functional cure for HIV. This trial will focus on investigating, the safety and efficacy of AGT103T as a monotherapy in patients who will not receive standard of care treatments. In this trial that you have asked us about, I think it's about 24 patients. They will undergo this process, a bit difficult to pronounce, but something along the lines of leukapheresis to remove T cells, which will then be developed and dosed with AGT103T before being reintroduced into the body. We hope you're understanding this, Dr. Nagaraj. Patients will be then randomized into 3 arms with differing durations of time before being taken antiretroviral therapy, which is the current SOC, standard of care, for HIV patients, because there's no magical cures. There's only ART, ladies and gentlemen. So the sponsor will be blinded, but neither the patient nor the investigator will be blinded. This approach, AGT 103T, demonstrates an innovative strategy in the pursuit of a cure for HIV, and the trial's design reflects careful consideration of various factors, including patient safety, our number one priority, and efficacy assessment. All right, isn't that clear? So we're hoping that you're understanding this. Regarding the competition, it's essential for companies like Adamune, a company that we really respect here at Actual Edge. Many times we have comments from people saying, oh, you're only trying to make money. Adamune is only a scam. Well, every single company in the world is trying to make money, don't get me wrong. Only government funded companies are, in a way, not chasing a profit. But of course, Adamune is a private corporation trying to make money. Wouldn't you? Regardless of what your field is, we understand that healthcare might be a little bit more delicate. Everyone says healthcare and education should always be free. But Adamune, in that sense, we need to stay abreast of advancements and initiatives undertaken by other biotechnology firms and pharmaceutical companies working in the same space. This helps in understanding the broader landscape, potential challenges, and opportunities for collaboration or differentiation in the development of HIV therapies. And you have another question. Okay, so Nagaraj, we hope that we already answered the question about AGT 103T. Is there any progress about EBT 101? Yes, there is. The phase 2 drugs for HIV infections have a 38% phase transition success rate. Indication benchmark for progressing into phase 3, according to global data. This benchmark is crucial for evaluating the likelihood of advancement from phase 2 to phase 3 trials for drugs targeting HIV, Dr. Nagaraj. Another company, Excision Biotherapeutics, EBT 101, currently in phase 2 of clinical development, with a lot of news mentioning it on a daily basis, is aimed at treating HIV-1 infection. Utilizing adeno-associated virus, also called AAV9, this delivery of CRISPR Cas9 guide RNAs directed to HIV-1 upstream promoter region, EBT 101 showcases promising potential for addressing underlying mechanisms of HIV infection. However, Global Data's comprehensive report assesses EBT 101 drug-specific PTSR and likelihood of approval, also called LOA, scores, comparing them to the established indication benchmarks derived from 18 years of historical drug development data. These evaluations consider various attributes of the drug and the company and its clinical trials are offering valuable insights into EBT 101 potential for successful progression through clinical development stages. So EBT 101 is on phase 2, waiting to get on phase 3. Remember, there's usually a 38% of success for trials that go from phase 2 to phase 3. So stay tuned, and maybe in the next 5 or 6 years, we see a little bit of progress and we can get closer to the desired sterilizing cure that a lot of people are looking forward to. And Dr. Nagaraj, I feel like that's been our answer to these two questions. If you have any other questions, please let us know. Please let us know, and we will assist you as soon as we can. We want to help every single person here. We want to know you're not alone. We want you to know that at Actual Edge, we care. We care. We really care. We want to help. We want to be part of a larger community. So if you're still there, please, just to let you know, we are continuing answering questions. We're very happy to be here, and whatever you guys need, we will be very happy to assist you. So don't forget that all our comment section is still open to any single question that our delightful and marvelous subscribers may have. Okay, now we're going to continue talking a little bit while we wait for new questions about HIV myths. We're a bit tired, well, not tired, but sometimes people come to our channel and they say, Actual Edge, uh, I had sexual contact with someone who had HIV. What should I do? Oh, I wore the same jacket as someone who has HIV. Well, I got HIV. Well, today is your lucky day. Today, we are debunking HIV myths. Today, we have another question. David, I would like to ask you if people with HIV can have healthy children. 100%. 100%, but we need to also be aware that breastfeeding could be a consequence of your kid getting HIV. So always ensure, David, if you do have the disease, that with proper medical care, people with HIV can have healthy children and prevent the transition of the virus to their partners and babies. Advances in medicine have made it possible to significantly reduce the risk of vertical transmission of HIV from mother to child during pregnancy, childbirth, and breastfeeding. So, David, if you happen to have this virus, if you happen to be worried about it, if you and your partner want to have a child, but you fear giving HIV to your newborn, we completely understand this. And just to let you know, nowadays we can prevent it, and advances in medicine have made it possible. Dr. Nagaraj, thank you so much, sir, for the explanation. Our pleasure, Dr. Nagaraj. We're here to support. We want to help. Whatever questions you have, put them in the chat box. And if we don't know the answer, we will tell you. We'll be honest. But we've been doing research on HIV for a very long time. And we are in touch with a lot of hospitals, with a lot of doctors. In recent times, more people are feeling more optimistic about this virus. Imagine having HIV in the 90s or in the 80s. What will happen? You didn't have any medication to treat it. Doctors didn't have enough information. What would be the outcome of it? A lot of people dying. Nowadays, who dies of HIV? Only those countries that cannot afford getting ARTs. We know, for example, South Africa's government. They've been providing HIV for free in many hospitals for population that suffer from this horrendous disease. That's what we want. However, let's talk a little bit about myths related to HIV. And if you have any questions, welcome everybody. If you just arrived to the live stream, we are delighted to have you here. Welcome India, welcome South Africa, welcome United States, welcome Zimbabwe, welcome Kenya, welcome Nigeria, welcome UK, welcome France, welcome Germany, all of you, welcome here, welcome Taiwan. We know we have loads of followers in Taiwan. If you have any questions, please let us know in the chat box. We'd be more than happy to assist you. The first myth about HIV that I wanted to comment is ART has terrible side effects. Well, while older HIV treatments were associated with severe side effects, like, for example, hair loss was quite common, skin rashes was quite common as well, anemia, but modern ART has far fewer and less severe side effects. Most side effects are temporary, and after a few weeks taking ART, they diminish, and sometimes they disappear completely. It actually depends on the person. Some people struggle with side effects for longer periods of time, others don't. So severe long-term side effects, thank God, are rare. And if a medication causes problems, your doctor can switch to a different medication that might be more suitable to you. The doctors care for you, you know? Doctors are not trying to scam you. The people trying to scam you are here on YouTube. Are the people telling you that they found a cure for HIV and if you pay them money, they'll send you some ridiculous tea or a ridiculous plant? That will do nothing. Dr. Oburu, you are a scammer. Stop putting comments in our videos, Dr. Oburu. Stop lying to people. Stop taking people's money. You are not a doctor. If you were a doctor, you wouldn't be saying these things. You wouldn't be trying to scam people. Stop it. People are dying. People are suffering. Stop playing with people suffering. Do something good. Inform people. Stop trying to scam them. I'm sorry, guys. I don't want to get angry, but it makes my blood boil to think that any of our subscribers are falling for these horrendous scammers that put comments on a daily basis on our videos. And unfortunately, we can't be erasing all of them. It's really, really annoying. Okay, we have another question. I'm a new person in Spain. I was having HIV when I was in Ghana. Where do I get HIV medication in Spain? Okay, Mr. Owusu or Miss Owusu Faustina, welcome to our channel. The first thing, we want to let you know that Spain is a country that we feel extremely close to. I'm part of my blood is Spanish, and we want to assist you with this question and provide you the best system. Now, as a newcomer to Spain seeking HIV medication, you can access treatment through the Spanish healthcare system. This is the process you need to follow. Mr. Owusu or Miss Owusu. We're not sure if it's a Mr. or a Miss. But the first thing you need to do is register with the Spanish healthcare system. If you are a legal resident in Spain, you are entitled to healthcare through the public system. Spain has one of the best public healthcare systems in Europe. So, Owusu, you need to register with the Spanish Social Security System. It's also called Seguridad Social. If you live in Spain, it should be very easy, as Spain has really good programs to integrate African immigrants and to provide them with whatever medication is needed. The second thing you need to do is obtain through your Seguridad Social a health card. Sorry, Owusu Faustina, I have a question. Are you staying in Spain legally or illegally? Don't worry, we're not going to, we're only asking the question because if you're staying illegally, the process might be slightly more complex. So please let us know in the comments if you're staying in the country legally or illegally, and we'll advise you in the most convenient way. Again, we will not judge. We understand perfectly that sometimes we need to relocate to a different place and we don't have the opportunity of making things the legal way. So, Owusu Faustina, please let us know. Are you staying in Spain legally or illegally? Now, if you're staying legally, visit a healthcare center. Any healthcare centers from the Seguridad Social will be able to help you. They cannot sack you to your country for having HIV. Well, David, I'm not sure about this. You probably know more about this topic than I do. But yeah, I would strongly doubt. I don't think hospitals in Spain have any power to send anyone back to your country. I think it's only the police, and healthcare facilities don't tend to call the police on immigrants. They will try to give you the best support, and there's usually loads of associations providing services from people who are um, who are staying in the country without legal papers. So once you have your health card, you need to visit your local healthcare center. They will assign you a general practitioner, also called Owusu Médico de Cabecera, and he or she will evaluate your health needs. Now, after this, we will need a consultation with a specialist. Your general practitioner will refer you to the specialist in HIV/AIDS treatment, often an infectious disease specialist or HIV specialist who will assess your condition and prescribe appropriate medication. Obtaining medication will be possible after your consultation with the specialist. In Spain, pharmacies are widely available and you can purchase medications with prescription from a doctor in a very easy way and in a safe way. Let me finish answering these questions and then I'll address Dr. Nagaraj with the biannual infections for HIV and from SG. Sharkona Ivone Wukum. Give us a second. We're just going to finish responding to Mr. Owusu first and about the procedure on how to get HIV medication in Spain. Now, it's crucial to adhere to whatever medication your médico de cabecera or main doctor has told you to maintain. Regular follow-up appointments will be scheduled to monitor your progress and adjust treatment if necessary. Now, if you need additional support, you can contact HIV and AIDS organizations and support groups in Spain. If you don't have legal papers or a passport in Spain, I would advise you get in contact directly with these associations and they will be able to provide you with medication in a different way. Regular follow-up appointments will be scheduled to monitor your healthcare. Remember, get in touch with HIV/AIDS organization support groups in Spain. They can provide you information, resources, and assistance. Remember, seeking treatment for HIV is confidential, and healthcare professionals are bound by strict confidentiality laws. Don't hesitate to reach out. Don't be scared of Spanish doctors. This is not the US. This is Europe. In Europe, we believe that everybody has the right to stay in our countries regardless of having a passport or not. So please, Mr. Owusu Faustina, do not be scared. Contact your doctors. They have confidential laws. They can go to jail if they don't maintain it. Asage, do not try to threaten us. Stay out of our channel. We do not want you. If you have problems, solve them yourselves. Do not threaten us. Here we're trying to provide support. Don't take us for granted. Thank you very much, El Duende Satírico, for removing comments of people who are making empty threats. Dr. Nagaraj, sir, any updates about biannual injections for HIV? Yes. Injectable medications represent a significant advancement in HIV treatment. It's a great alternative to oral pills because daily pills could be sometimes difficult and difficult to maintain. And they've been the standard of care for decades. One of the pioneering combinations in the realm is two medications. If you want, let's see if El Duende Satírico can write it down in the chat box for you. But it's the combination of cabotegravir and rilpivirine. These are administered via long-acting injections once a month or every 2 months. These injections have garnered approval from regulatory authorities in several countries, including Argentina, including Australia, including Canada, including every single country in European Union. Excuse me. Including Japan, Russia, UK, US, and United Arab Emirates. Now, it's still not available in India, I believe. However, I know that the United Arab Emirates has some really good deals. The Indian government and the UAE government are usually in touch. So I think that there's an option of getting them in India, Dr. Nagaraj. Now, the rationale behind injectable treatment stems from the desire to address issues related to adherence, privacy, and convenience. For individuals living with HIV, particularly those who may struggle with daily pill taking or who wish to maintain their HIV status discreetly, injections providing a promising option. To add a bit to this, moreover, they may prove beneficial for those who face challenges with medication absorption or who have difficulty accessing healthcare services regularly. We are aware that certain regions of India don't have a great public healthcare system, and private consultations may be extremely expensive and unaffordable. So, the availability and accessibility of injectable treatments can change across different regions. While high income countries have made significant strides in incorporating injectable medications into their healthcare systems, their implementation in low and middle income countries present challenges related to cost, infrastructure, and healthcare delivery mechanisms. Additionally, the clinical trials that led to the approval of these medications predominantly involved participants from higher income countries, raising questions about their applicability and efficacy in more diverse settings, such as Africa, such as India, such as certain countries in Southeast Asia. Despite potential benefits, injectable treatments come with their own set of considerations and limitations, Dr. Nagaraj. For example, injection site reactions such as pain, swelling, discomfort are common despite typically being temporarily. Furthermore, the need for regular clinic visits to receive injections may pose logistical challenges for some individuals, potentially impacting their willingness to adopt his treatment modality. Another critical aspect to address is the risk of drug resistance if injections are discontinued without transitioning to an alternative HIV treatment regimen promptly. Since injectable medications remain in the body for several weeks or months after the last injection, there is a concern that viral replication may occur during this period, potentially leading to the development of resistance. Ongoing research endeavors aim to address these concerns and further enhance the efficacy and safety of injectable treatments. Studies exploring the use of injectable medication during pregnancy in combination with other medications and hormone therapies and in diverse populations are underway. Additionally, efforts are being made to develop new long-acting treatments that offer greater convenience, number one. Number two, affordability. Number three, accessibility. So, Dr. Nagaraj, in conclusion, I know the answer has been a little bit longer than we expected, but we just want everything to be super clear. While injectable medications represent a promising advancement in HIV treatment, their widespread adoption and integration into global healthcare systems require concerted efforts to address various challenges. By addressing issues related to cost, accessibility, adherence, and safety, injectable treatments have the potential to revolutionize HIV care and improve the quality of life for individuals living with the virus worldwide. Thank you for your question, Dr. Nagaraj. Always a delight to have you in our live streams. Okay, and David has another question. Do you know something about the latest news of cabotegravir? Yes, we do. Recently, at the Conference of Retroviruses and Opportunistic Infections, CROI 2024, held in Denver, Colorado, USA, a study was presented regarding a potential breakthrough in HIV treatment. This study evaluated a new formulation of cabotegravir, also marketed in certain countries as, what's the name? Vocabriar. That's the one. This could potentially allow for injectable administration every 4 months, as opposed to the current monthly or bi-monthly injections. In a small phase So it's this clinical trial still on phase 1. This new formulation administered subcutaneously or intramuscularly achieved similar drug levels in the bloodstream as the currently approved formulation. However, there's always a however, isn't there, David? These levels were maintained for a longer duration. Injectable cabotegravir is currently the only acting pre-exposure prophylaxis strategy for HIV prevention, while the combination of cabotegravir and rilpivirine, or also remember, rilpivirine is also called in certain countries rincambis, is the antiretroviral treatment requiring the fewest administrations, once every 2 months. To further extend the duration of cabotegravir in the body, various possibilities have been explored. In this study, 2 formulations were compared, one using the currently approved injectable cabotegravir formulation at 200 milligrams per milliliter, referred to as CAB200 in case you want to check it up on the internet, combined with recombinant human pH20 enzyme to prolong its plasma half-life, and another using a new formulation of cabotegravir with a longer plasma half-life than the currently approved one, also known as CAB-ULA. You can look it up in the internet. It's super interesting. A total of 70 HIV negative volunteers participated in the study with diverse demographics. In the first part of the study, volunteers received various doses of CAB200 administered subcutaneously with rHuPH20. In the second part, they received various doses of CAB-ULA, both intramuscularly and subcutaneously, and volunteers who received CAB-200 with rHuPH20 showed higher peak plasma levels and greater drug exposures than those receiving CAB-200 alone. However, the combination of CAB200 with rHuPH20 was associated with tolerability issues, with injection site reactions experienced by all participants and severe reactions observed in some cases, leading to the discontinuation of further investigation of this combination, which we already informed you about in our YouTube channel. Okay, so researchers estimated that intramuscular CAB-ULA could be administered every 4 months, while achieving greater drug exposures than CAB-200 administered every 2 months. No differences in plasma levels were observed based on gender. The intramuscular formulation of CAB-ULA will continue to be investigated in clinical trials as both antiretroviral treatment and PrEP. In a nutshell, CAB-ULA could become an important therapeutic option for both antiretroviral treatment and PrEP. Lenacapavir, also marketed as Sunlenca, with semi-annual subcutaneous administration, may pose significant competition for CAB-ULA, but also offers an opportunity for long-acting dual therapy. Additionally, having 2 long-acting PrEP options is beneficial for users, providing a backup option in case of toxicity or tolerability issues. David, we hope that this is clear. The reason I've been telling you to Google these concepts is that it might be difficult for you to grasp if you don't have any medical knowledge. Well, David, it's our pleasure. And Dr. Nagaraj, thank you, sir, for the information given. Dr. Nagaraj, it's our pleasure. This is what we do in Actual Edge. We stay here with you to give you the best ideas for treatment. We are hoping you're enjoying the live stream. We see that there's 14 people and 20 likes. If you're in the live stream, make sure you're hitting that like button. Give us our like so this live stream could reach more people. We want everybody to be part of this community. Don't forget, Hit that like button if you're just joining us right now. Everybody, hit that like button. Let's blast it. Let's ensure that Actual Edge will get to everyone that has this virus. If you have any questions, continue to post them in the chat box. We'll be more than happy to assist you. We're going to stay a little bit longer in this live stream because we're having an amazing time here with you. Dr. Nagaraj, David, Mr. Owusu, we're all, Mr. Daleen, Mr. Achavi, we're all very happy to be here with you. Please keep those questions coming. And if you just entered the live stream, remember that like button really helps us. We are not going to ask for donations. Not even once has Actual Edge asked anybody to donate any money. We don't want your money. Don't give us money. Just give us your like. Give us your support. Give us your question in the chat box. That's our goal. At Actual Edge, we're a team of two people. One is my moderator and also taking care of all the technical aspects of live stream, of videos. And then there's me, the face, the voice of Actual Edge. But we work very hard together, trying to provide the best service to all our followers. As we were mentioning, there's many myths related to HIV. This myth really makes us angry. Some people that say you don't need to start ART until you feel sick. No. As soon as you know you have HIV, as soon as you consulted your medical doctor, start HIV treatment as soon as he or she tells you to do so. Without treatment, HIV can cause irreversible damage to your immune system, ladies and gentlemen, making you more susceptible to illnesses in the future. Everyone diagnosed with HIV should receive ART regardless of their CD4 cell count. Be it high, be it low, don't worry, take ART. Keep that virus in remission. Keep that virus from developing in your body. Keep that virus from expanding to become AIDS and having a short life where your family cannot stay with you. Please. Another myth. People with HIV can infect others during everyday social activities. Lies. HIV can only be transmitted through specific bodily fluids entering another person's bloodstream. Everyday activities like hugging, talking, sharing utensils, using the spoon from someone who's used HIV, it doesn't matter, even if it hasn't been cleaned. Kissing someone with HIV, it doesn't matter. Even having mouth to genital contact doesn't matter. Now, there's two aspects, anus and genitals, because the anus contains a lot of veins and it might be tighter, putting pressure on the male genitalia. The risk of contracting HIV with this practice might be a lot higher. Also, skin color plays an important role, and people that, black people, have a higher tendency of getting HIV than white people. So it's another thing to take into considerations. Okay, Dr. Nagaraj, another question. Sir, any updates on long-acting oral ART? Now, updates per se, I wouldn't say that there's many. Most of the ART's updates come from mainstream magazines. The long-acting therapy to improve treatment success in daily life, called Latitude, Latitude is what it stands for. Study, it has shown promising results regarding the effectiveness of long-acting ART for individuals struggling with adherence to daily oral ART for HIV. Interim findings from the Latitude study indicate that long-acting ART is more effective than daily oral ART in achieving viral suppression for individuals who have difficulty following their medication regimen. An independent data and safety monitoring board recommends stopping random assignment of participants in the Latitude study and allowing all eligible participants to take long-acting ART based on the positive interim results. In the United States, approximately 70% of people taking ART achieve HIV viral suppression. But adherence to daily oral medication can be challenging for some individuals. The Latitude study is ongoing in 31 sites in the US, initially enrolling patients to receive adherence support while taking daily oral ART to achieve viral suppression. Those who achieved viral suppression were the randomized to receive the long-acting ART every 4 weeks or continue with oral ART. The DSMB review of interim data showed that long-acting ART administered once every 4 weeks was more effective than daily oral ART, leading to the recommendation that all study participants should be allowed to choose their preferred form of treatment. Injectable ART, including cabotegravir and rilpivirine, is approved in the US for dosing every 2 months, potentially requiring treatment only 6 times per year. These findings highlight the potential of long-acting ART to address challenges and improve outcomes for individuals living with HIV, offering a promising alternative to daily oral medication. So, Dr. Nagaraj, that is our answer. We hope it's clear. Guys, just as a reminder, I know we have a lot of people in our live stream right now, 15 people watching. We have 22 likes. Continue clicking that like. Continue asking those questions. We only have a few minutes left of our live stream. So remember, if we can assist you with anything, it's our pleasure to be here every day. The Actual Edge team has a lot of meetings, not only among us to ensure that we have the correct content to deliver to our dear followers, but also here, what we want is everybody to be aware that there's a safe space for you. There's a place for you to come ask your questions without being judged. We are probably not based in the country where you're from. We're not in India. We're not in South Africa. We're not in Nigeria. We're not in Kenya. But the thing is, we are in contact with healthcare providing systems in all of these countries. If you come to our comment section to share your problem, to share your case, we might be able to help you. And what do we expect in return? Are we going to ask for money? No, we will not ask for money. In Actual Edge, we don't believe in that. No. We have received one donation in Actual Edge in our documentary. Our documentary, which, by the way, Duende Satirico, if you want to share in the chat box, it's been acclaimed. We're not going to say which media, but one of the biggest media outlets has gotten in contact with us because of that documentary, because of the information we provided in that documentary. Some people have said that their life was changed because of that documentary. We had a comment there of someone who donated us a lot of money. We got in touch with that person. We told that person, thank you for donating. But for us, the biggest gift is that you just click like. For us, the biggest gift is that you write a comment. For us, the biggest gift is that you tell us thank you for helping me out. We're not chasing the money. We don't want your money. We leave that for the disgusting scammers out there who promise that they will give you a cure, who claim that they have found it. Thank you, Duende Satirico. If you click on that link that my partner has shared with you, you can access our documentary. Honestly, we feel extremely proud of that piece of art. We put a lot of effort. It took us a good few months to put it together. We needed to contrast all the information in there. We needed to make sure that the information we were giving you was accurate. And we are delighted to see that it has been... Oh, Jesus. Okay. Guys, we are going to have to leave. Thank you very much for joining our live stream today.